Mr. Crow, good afternoon. My name is Matt Jernigan, and I'll be your student nurse today. Can you please provide me with your full name, your date of birth, and your MRN? While patient does that, I'll make sure I wash my hands with soap and water and down gloves. Mr. Crow, do you have any allergies to food, medications, the environment, latex, or tape? Okay. The information you provided me with matches the information in your chart. Mr. Crow, I also see your vital signs right here. Your heart rate is 120 over 80, which is normal. Your respiratory rate is 15 breaths per minute, which is normal. Your heart rate is 70 beats per minute, which is normal. Oxygen saturation is 99%, which is great and normal. And your temperature is 98 degrees, which is normal. Mr. Crow, can you please tell me a little bit more about the pain that you're having in your back? Can you please tell me about the onset of that pain? Can you tell me about the location? Where exactly in your back is that occurring? Can you please characterize that pain for me? Can you tell me what makes it better? What makes it worse? Have you tried any treatments? And can you also tell me about the level of severity for that pain? On a scale from 0 being no pain at all to 10 being the worst pain imaginable. Patient exhibits no signs of distress. Patient is also oriented to person, time, and place. Also, if there was any kinks in IV tubing or catheter or oxygenation, I would assess them accordingly and make sure that they were functioning and there were no problems or no kinks present. Okay, Mr. Crow, I'm going to take a look at your hair, skin, and nails. I'm going to start by looking at your scalp, okay? Okay, scalp is normal cephalic. Okay, there's no hair loss present. Take a look at your cap refill. Okay, cap refill is less than 3 seconds. Okay, there is no edema present. Okay, Mr. Crow, I'm going to start looking at your eyes. Take a look at your hair. Okay. Eyebrows are symmetrical. Okay. Sclera looks white. Conjunctiva looks normal. Mr. Crow, can you please take a look at my light? Pupils are equal, round, reacted to light. Mr. Crow, look at my finger, and I'll look at the picture, and I'll look back at my finger. Okay, accommodation is present. I'm going to take a look at your nose. Okay, there's no drainage. Okay, I'm going to take a look at your ears, your external ears. I'll take an otoscope as well. Okay, pearly gray on that side. External features of the ears. There's no lesions or any damage. Otoscope, pearly gray. Mr. Crow, can you smile for me, please? Okay, smile is symmetrical. Can you please say ah for me? Okay, tonsils look like to be +2. Uvula is present. Okay, Mr. Crow. I'm going to take a look at your respiratory system now. Okay. Your diaphragm and your intercostal muscles appear to be functioning normally. Your breathing pattern is normal. It's within 15 breaths per minute, which is normal. And your heart rate is also normal at 70 beats per minute. Okay, Mr. Crow, I'm going to position you so that I can listen to your lungs and so that you're comfortable as well. I'm going to utilize my diaphragm, and I'm going to utilize the Greek key pattern as well. Okay, Mr. Crow. Can you please take a deep breath for me? Take a deep breath in, exhale. Take a deep breath in, exhale. 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 And deep breath in, exhale. Okay, Mr. Crow. No adventitious sounds are present. Was that your light of breath? Okay, I'm going to sit you back, and you just breathe normally. We'll give you a break for a second. Also, if a patient had an incentive spirometer, I would educate the patient on how to use that. Okay, Mr. Crow, I'm going to take a look at your cardiac system. I'm going to begin by feeling your carotids one at a time. Okay, no thrills are present. I'm going to feel your radial pulse here, and I'm also going to feel your Purcell's biggest pulse here. Okay. Pulse is +3 in each area, which is normal. And then I'm also going to inspect the 5th intercostal space, the PMI, for any lifts or heaves. Okay, Mr. Crow, I'm going to take a listen at your cardiac system now. I'm going to utilize the bell to listen to the carotids one at a time. Okay, no bruits are present here. Okay, Mr. Crow, I'm going to begin by listening to your right sternal border, and I'm going to utilize the bell and the diaphragm here to listen to your heart. Okay, I'm going to begin at the 2nd intercostal space after I find the angle of Louis, and I'm going to begin at the left sternal border. I'm sorry, the right sternal border. Okay, this is your aortic. And then I'm going to move over to the 2nd intercostal space, the left sternal border. This is your pulmonic. I'm going to move down to the 3rd intercostal space. This is Erb's point on your left sternal border. I'm also going to move to the 4th intercostal space. This is your tricuspid. And then I would do the midclavicular line for the 5th intercostal space, which is your mitral. Okay. No S3 or no S4 were heard. S1 and S2 sounded normal with a good rate and a good rhythm. No abnormalities were noted. Okay, Mr. Crow, have you had any change in feelings of your extremities lately? Have you noticed any tingling or loss of sensation in any parts of your hands or your feet, your arms or your legs? Okay. Mr. Crow, can you please grip my fingers real quick? Okay. And then I'm also going to have you please kick down on my foot, or on my hand. Kick your foot down on my hand. Okay? Is there anything else that I can help you out with today, Mr. Crow? Okay? I'm going to go document my findings and I'll be right back.